Good morning, everyone. My name is Britt Earhart, Public Information Officer for the County of Santa Clara. We're joining you today to share some information about preparations for COVID vaccine for children under age 5. We'll start with 3 leaders from the county sharing some information. Then we'll have time for your questions. After that, we'll move to the portion of the presentation with Spanish and other languages. With that, I invite Dr. Cody to join us at the podium.
Good morning, everyone. It's good to be with you as always. I'm joined by my colleagues today, Dr. Kamal and Dr. Rudman. And together we want to give you an update on where we are in the pandemic, an update on vaccines for kids under 5, and to let you know that here in the County of Santa Clara, we are ready. So to start off, I just want to acknowledge how difficult it has been for parents of young children, the only group that haven't had access to COVID vaccine throughout the pandemic. I think now there's good news on the horizon. As you know, the FDA has authorized COVID vaccines for children under 5. Now we just await the CDC's committee and the CDC director to recommend the vaccine, and we anticipate that will happen over the weekend. And as you will hear from my colleague, Dr. Kamal, we are ready to vaccinate. So vaccinating these young kids is really important, and I want to tell you a little bit about why. So even though the rate of severe COVID is less in the really young children as compared to older kids and adults, it's not really an apt comparison, right? Because young children are less likely to get sick from really anything as compared to adults. And there are kids who are getting really sick. In fact, in terms of hospitalizations nationally, kids under 5 had the highest rates of hospitalization compared to other older age groups. And not very many, but some children under 5 have died from COVID, over 400 in the country and 1 here in our County of Santa Clara. In addition, I just want to emphasize that severe disease is not the only outcome that's important. There's also long COVID among young children, as there is among other groups. And also, we know anyone who's parented a child under 5, that other layer of protection, distancing and masks, very difficult to implement in younger age groups. And so, so important to have a vaccine as another layer of protection for those young kids. So not only do we hope that these vaccines will reduce infection and transmission, but they will also make life just a little bit easier for families with young children. And it's one step closer to returning to something that looks like normal. So our ability to protect these young kids is still really important. I want to let you know where we are in the pandemic. When we look at our wastewater surveillance, which is our best indicator right now of levels, our levels of COVID in our community are still very high. In fact, when we look at our wastewater, it looks like we're almost where we were during the height of Omicron, which is pretty high. The good news is we do show some signs of leveling off or even decreasing in some of those sewer sheds, but it's high. So, you know, the weather is not good. Put your mask on when you're indoors. So I think I'll stop there and I will turn things over to Dr. Kamal to tell you a little bit about our preparations in the county and what you all can expect. Thanks so much.
Thank you. My name is Ahmad Kamal, Ahmad Kamal, and I am the COVID-19 Director of Healthcare Preparedness for the County of Santa Clara. Thank you all for being out here this morning, and we are absolutely thrilled to be at this moment when we are going to imminently start vaccinating the youngest members of our community. The county health system has been preparing for this moment for weeks, and we are ready to go. We're anticipating, as Dr. Cody said, approval and authorization authorization and a recommendation for this vaccine to be completed over the weekend. The shipments of vaccine may be arriving as early as Monday. If that were to happen, we would open appointments on Monday afternoon and start first shot in arms on Tuesday. If, however, that vaccine does not arrive on Monday, we will be ready to go whenever it does. Typically, it takes about 24 hours from arrival of the vaccine to when we have it in arms. So if they arrive on Tuesday, we'll go on Wednesday. In addition to our existing sites in San Martin and San Jose Fairgrounds, we are also preparing an additional site in Mountain View to serve our North County residents. We also anticipate that this site will be ready to go as early as next week. Initially, we will start out slowly, but we expect to ramp up to 1,000 vaccines per day very soon after starting. In addition to our preparations, we have been in touch with the major health systems throughout the county, as well as many private pediatricians' offices, which will be offering these vaccines. We encourage people who have a healthcare provider to talk to their doctors, to talk to their healthcare providers, and get the vaccine for their youngest children. We will aim, as we always have, to make vaccinations convenient, to make them accessible, to make them equitable, and to make them safe for every single resident of their county, regardless of where they live, regardless of their insurance status, and regardless of any other barriers we might face. I'll be open for questions afterwards, but before I leave, I will just remind everybody to go to sccfreevax.org for the latest information about these vaccines and also about making appointments. Thank you very much. And I turn it over to Dr. Rudman.
Sure. Thank you so much, Dr. Kamal. I'm Sara Rudman. I'm the Assistant Health Officer for the County of Santa Clara, and that's spelled SARAHRUDMAN. And I'm here to talk to you all as a public health doctor who has seen the way COVID has harmed our community for the last 2 years, but also as the mom of a 2-year-old who is just so relieved to finally be able to vaccinate my child. I certainly am going to be online scheduling the very first appointment I can get for either vaccine now that they've both been authorized. And as Dr. Cody was alluding to, I've personally felt but also watched our community go through the harms that COVID has caused for these youngest community members. We know that kids are tough and most of them do really well if they get COVID infections. But I was surprised to learn that almost 2/3 of kids who end up in the hospital with COVID don't have any underlying medical condition that would have predicted that they do badly. And as Dr. Cody was alluding, we think about 5% of kids with COVID might have long-term health effects from their infection. But that says nothing about all of the effects those of us have been feeling even without bad health outcomes for our kids. The hard work it takes to parent or be a caregiver for a small kid being compounded by how hard we work to keep our children safe. And so having this added layer of protection to make sure my child is in school or daycare every day as much as possible, to relieve the work to our families and our community's families of having our kids out sick over and over again is going to be a game changer for my family and I think for a lot of families across the community. So I have personally reviewed the data that was shared this week, and as a doctor and as a parent, the very first thing I looked at is, are these vaccines safe for our young ones? And yes, these vaccines are incredibly safe. What we saw was the expected minor side effects of getting a shot from these vaccines that we see from everything else. The things that reassure us that the shots are working. Our babies were fussy and a little sleepy and didn't eat as much right after their shot sometimes. Some of the kids were cranky and tired, which if you've got a toddler, you know it's hard to tell if that's the shot or just an average day with a toddler. But really, we were not seeing any scary side effects that we were worried about. And that's wonderful news for us and for the parents and caregivers in our community. And then, do these vaccines work? And we have now seen the data shared with all of us that show that they are extremely effective and a really important layer to protect our youngest children, as well as their families and the folks who come into contact with them. I was really pleased to see that the level of antibodies, the level of protection these vaccines give our youngest community members looks similar to what we've been seeing in older children and adults through the millions of folks who have been vaccinated in these older age groups. So I'm really relieved to see this. for me, for my family, for my kid, this vaccine could not come soon enough. But I'm also really glad that these trials took the time that they did to really study these outcomes, to gather as much data as they have, and to really show us how safe these are. Because with that level of study, both as a doctor and as a mom, I feel really good about getting my child vaccinated as soon as I can. And I'll also be here to take any questions I can about safety or efficacy. Thank you.
Thank you. At this time, our doctors are available for your questions. We'll start over here on the left, and if you might be able to indicate which doctor you would like to address your question to. Thank you.
Sure, I'll take your first question, and then I want to ask, I'll take your second question, and then I would like you to repeat your first question. So the question was, when I say high, how high are the levels of COVID in our community? What I am referring to is looking at our wastewater surveillance data, which generally tracks well with our case data, although it's a little less tight than it used to be. When we look at our wastewater surveillance, what we see in our largest sewer shed, which is San Jose, is that they peaked at a level almost as high as Omicron. It looks like they might just be beginning to come down. I'm a little hesitant to call it, but I want to give some optimism. Might be coming to come down, but that's still high, close to our Omicron peak. And in the other sewer sheds, which are smaller, it's also quite high, looks a little bumpy. Maybe we can imagine a plateau. The take home is COVID levels are almost as high as they were at the peak of Omicron, and it is really important to wear your mask when you are indoors to protect yourself. Please repeat your first question. The percentage of the doses as compared to adults. I am going to turn that question over to Dr. Kamal. Thanks.
Thank you. So the doses for the youngest children will be lower than the doses that we typically give to older children and to adults. For the Pfizer vaccine, it'll be a 3 microgram dose, which is going to be given over a 3-shot sequence. And for the Moderna vaccine, it'll be a quarter of the adult dose that will be given over a 2-shot sequence. I think many people may have questions about which vaccines to get, and what we can tell you is that both these vaccines are incredibly safe, incredibly effective, and you should get the vaccines that are available to you. Thank you.
Take another question. Agency?
You know, it's been a long wait for kids this young to be able to get them. It was not an ideal wait, but how are you guys able to utilize that time in terms of rolling out plans for hopefully when they're maybe next? Was it beneficial?
Absolutely. The last 2 years have been tough for all of us, but they also have been educational for us. We have learned how to deliver vaccines safely, effectively, and equitably to every corner of our community. We have prepared for this. Our teams are ready. They are excited, and they're ready to go. Thank you.
I will. Thank you for your question about how to think about parents who are struggling with the decision whether to vaccinate their child and when. I think a couple of things are really important. As we talked about earlier, these vaccines are incredibly safe. Not only were they studied closely in the trials, but we have the millions and millions of older children and adults who've received them at these slightly different doses for the last months, more than a year. So we have a lot of information to tell us these are safe. In addition, I think it's important to know that there is still a benefit to getting vaccinated, even if you've already had COVID. We know this especially from the older age groups we've had longer to study since they've been vaccinated, that show us that, yes, you may get a little bit of protection after you were sick, but the added protection of getting vaccinated afterwards is significant and helps reduce serious disease, getting infected at all, and those bad outcomes like ending up in the hospital or even worse. So we think it's really important, even if you've had COVID, to consider getting vaccinated as well. The trials ran different ranges during different components of them over the course of months and involving thousands of children. There were different phases to each of the trials. First focusing just on getting the dose right, then focusing just on safety, and then finally to demonstrate that we see the proof of immunity in a laboratory and then proof of immunity in real life, the efficacy that we want to see to know that these vaccines are worth putting in our children. I don't have that right in front of me. We can get back to you with that, but it was several different trials that ran for different periods.
Moving back across.
How big is this population that the county is anticipating to vaccinate?
So there are approximately 100,000 children in the age group between 6 months to 5 years. There are approximately 100,000 children in the age group of 6 months to 5 years in our county.
Across again, then. Anything more?
The entire population of Santa Clara County, including those eligible and not eligible, over 86% of our population is vaccinated, and over 70% of people eligible for boosters are boosted. The COVID pandemic has been characterized by enormous change. And the virus that we're fighting has changed. So the subvariant, right now we're in a subvariant wave, subvariants of Omicron. Those subvariants behave quite differently than the original strain. So while it's incredibly important that every single person eligible to be vaccinated and boosted gets vaccinated and boosted to protect themselves, the vaccines aren't as good as they were about stopping community-wide transmission. So we really urge everyone, we've talked about protecting your community all along, but this is actually important to protect yourself. Get vaccinated and boosted to keep yourself out of the hospital, to keep yourself from getting long COVID. That is really important.
About the process to get these vaccines. You say they'll hopefully be arriving Monday. How can people get their hands on them?
So check our website. What we are telling you, as Dr. Kamal mentioned, we are ready to go. As soon as the vaccines arrive, we can turn it around in about 24 hours from when they arrive to when we can get shots in arms. We don't have total control over when they arrive. We anticipate it will be early next week. But
This is the kids, it's 2 weeks in between doses, right?
it's different per vaccine. I'm going to have Dr. Kamal repeat that for you.
Thank you, Dr. Cody. Yes, so for the Pfizer young child vaccine, it's a 3-dose series, and for the Moderna, it's a 2-dose series, and the intervals are correct as you stated. It's a great question. We don't have that data yet. We don't have that information yet, but you'll wait and see.
Thank you all. At this point, we'll move to the Spanish portion of the press conference, inviting Miguel Màrquez to the podium.
Good morning. My name is Miguel Màrquez. I have the privilege of serving as the county's Chief Operating Officer, and I also have the privilege of delivering this message in Spanish to our community. Buenos días. Mi nombre es Miguel Màrquez. Soy el jefe de operaciones por el Condado de Santa Clara. Tenemos nueva información sobre el COVID en nuestra comunidad y sobre las vacunas por los niños menores de 5 años de edad. En este momento se parece que los casos de COVID van a seguir aumentando hasta los últimos días de junio. Por esa razón, es importante que sigamos tomando medidas para mantenernos sanos, como vacunarse, ponerse un refuerzo como cuando corresponda y usar máscaras en el interior de los inmuebles como recomiendan los departamentos de salud pública del estado de California y del condado de Santa Clara. También es importante saber que algunos estudios demuestran que aproximadamente la tercera parte de los menores que contraen COVID no desarrollan anticuerpos contra el coronavirus. Es común que un caso leve de COVID no genera la respuesta inmunitaria necesaria para proteger a la persona contra la enfermedad. Al respecto a la vacuna, las autoridades en Washington están reunidos hoy y mañana. Según la decisión que tomen, el condado podría recibir vacunas tan pronto como este mismo lunes para los menores de entre 6 meses y 4 años de edad. Si aprueban las vacunas y si las recibimos el lunes, se podrá sacar cita ese mismo día en www.sccvacuna.org. Y las primeras vacunas se aplicarán el martes a quienes tengan una cita programada. Como ustedes ya saben, Santa Clara no pregunta sobre la situación migratoria de las personas y, como siempre, el condado ayuda a todos aquellos que no tienen seguro médico. A las personas que tienen un proveedor de salud, les sugerimos que contacten a su médico de cabecera y que los centros de salud también recibirán dosis de esta vacuna pediátrica para los menores de entre 6 meses y 4 años. Esta vacuna es recomendada por nuestra directora de salud pública, la doctora Sara Cody. Y por último, quiero mencionar que el condado de Santa Clara habilitó una nueva clínica de vacunación en Mountain View para los habitantes que viven en el parte norte de nuestro condado. Aquí, a continuación, daremos este mensaje en vietnamita. Gracias por su atención.
Thank you so much.
Just this way, please. Just this way, please. Thank you. Thank you for your attention.
Kính thưa quý vị, hôm nay chúng tôi xin được cập nhật về tình hình COVID-19 trong quận hạt của chúng ta và thông báo về kế hoạch tiêm ngừa của quận hạt cho trẻ em dưới 5 tuổi. Chúng tôi đã dự đoán đợt bùng phát COVID-19 lần thứ 6 này sẽ đạt đỉnh điểm vào cuối tháng 6 và chúng tôi cũng tiếp tục nhìn thấy các chỉ số tăng lên trong nước thải của ống cống. Vì vậy chúng ta vẫn cần tiếp tục giữ an toàn, bao gồm việc tiêm ngừa, tiêm liều hỗ trợ khi đủ điều kiện và mang khăn che mặt khi ở bên trong nhà tại các địa điểm công cộng, theo như hướng dẫn của tiểu bang và quận hạt. Trong khi chờ CDC phê duyệt qua các phiên họp hôm nay và ngày mai, theo kế hoạch thì quận hạt sẽ nhận được thuốc ngừa cho trẻ em từ 6 tháng đến 4 tuổi, với số thuốc đủ cho 2 tuần lễ đầu tiên là khoảng 32.000 liều và sau đó sẽ nhận được thêm một số thuốc nữa cho thời gian kế tiếp. Trong trường hợp CDC phê duyệt và quận hạt nhận được thuốc vào thứ Hai tới thì công chúng có thể bắt đầu lên trang mạng www.sccfreevax.org vào cuối ngày thứ Hai để ghi tên lấy hẹn tiêm ngừa. Các hẹn tiêm ngừa đầu tiên trong quận hạt cho nhóm tuổi này sẽ bắt đầu vào ngày hôm sau, tức là ngày thứ Ba. Tuy tỷ lệ nhiễm COVID-19 trở thành nặng trong cái lứa tuổi này thì sẽ thấp hơn so với người lớn. So sánh này cũng không có được phù hợp cho lắm vì trẻ em trong lứa tuổi này không bị bệnh hay tử vong thường xuyên như người lớn, nhưng có những trẻ cũng bị bệnh rất nặng. Trẻ em dưới 5 tuổi có tỷ lệ nhập viện cao nhất trong số các nhóm trẻ khác, và cứ mỗi em phải nhập viện, 4 em phải nhập viện thì có 1 em phải được đưa vào phòng khám chăm sóc đặc biệt ICU. Có 442 trẻ em đã qua đời vì Covid-19 tại Hoa Kỳ, và trẻ em cũng bị di chứng hậu Covid, chớ không riêng gì người lớn. Và các cuộc nghiên cứu cho thấy gần 1/3 trẻ em không tạo ra được kháng thể chống lại Covid sau khi nhiễm bệnh. Thông thường thì những trường hợp nhiễm bệnh nhẹ sẽ không khiến cho cơ thể có thể có được những cái phản ứng thích nghi cho các trường hợp nhiễm sau này. Và phụ huynh một khi thuốc ngừa được phê duyệt thì cần lấy hẹn để cho trẻ dưới 5 tuổi được tiêm ngừa. Và như thường lệ thì quận hạt sẽ không hỏi han gì về tình trạng di trú của quý vị và luôn sẵn sàng giúp đỡ cho quý vị nếu như quý vị không có bảo hiểm sức khỏe. Liều lượng tiêm ngừa cho các em rất là an toàn. Thì hiện nay là 1/3 liều của Pfizer cho trẻ em từ 5 đến 11 tuổi, và cho trẻ em dưới 4 tuổi thì chỉ có 1/10 cái liều lượng của người lớn mà thôi. Và các em sẽ được tiêm 2 liều cho thuốc Moderna và 3 liều cho thuốc Pfizer. Chúng tôi khuyến khích những người có bảo hiểm hãy liên lạc với bác sĩ của mình, vì các bảo hiểm y tế lớn cũng sẽ nhận được thuốc ngừa riêng cho lứa tuổi này. Và ngoài ra quận hạt cũng mở một địa điểm tiêm ngừa mới ở Mountain View để thuận tiện cho cư dân ở phía bắc quận hạt. Xin cảm ơn quý vị. Chúng tôi là Như Hạnh, và hôm nay sau đây là phần trình bày bằng tiếng Hoa của buổi họp báo hôm nay. Xin cảm ơn tất cả.
大家好，我是 Santa Clara 县政府的 Benny Chan。一开始先让大家来更新一下疫情的现况。Santa Clara 县持续的监测我们县里面的污水新冠病毒的含量，数量是持续上升而增加的，所以请您继续的做好防疫的工作，不要掉以轻心。然而，就算我们的疫情有一些上升的趋势，我们县内仍然保持比较低的住院率还有死亡率，这些都是因为县内疫苗接种普及的缘故。针对5岁以下的孩童提供的新冠肺炎疫苗，也将预计会被 CDC 所批准，并且在下个星期一运抵圣县，再分发到各指定的地点。民众可以通过 www.sccfreevax.org 这个网站，替这个年龄段的孩童来预约接种疫苗。网站里面提供了县府疫苗注射的地点，以及医疗保健提供方还有药局等等的连结。在此要特别说明的是，网上预约要在确保疫苗供应到位之后才会开放。目前预计最早大概会是在6月20号，也就是下周一的下午。圣县有大约10万名5岁以下的孩童。本县除了透过加州政府还有联邦卫生资源和服务局取得疫苗以外，像是 Kaiser Permanente 还有 Palo Alto 医疗基金会等等跨县的大型医疗机构，也都会直接的从政府管道取得疫苗。我们鼓励家里面有5岁以下孩童的家长带着您的孩子去接种疫苗。疫苗是免费的，也不需要保险。虽然跟成人相比，这个年龄段的儿童比较少有染疫后转重症的。但是跟其他年龄段的儿童相比，5岁以下的孩子感染新冠肺炎却有最高的住院率。疫苗能够帮助降低感染，让孩子的学习跟活动都不至于中断。根据相关的法规，有年龄要求的疫苗施打工作必须由药剂师来进行，因此可能不是所有参与疫苗施打计划的药局都可以替幼童来施打疫苗。民众除了可以透过 www.sccfreevax.org 来查询现有的诊所地点以外， Mountain View 也就是三井城呢，也将设置一个新的圣县北区的疫苗注射中心。 这个疫苗中心预定会在下个星期一设置完成，周二正式的启用。另外要注意的是，幼童注射疫苗将会采取预约制，也就是说，请您不要在没有预约的情况之下，直接带您的孩子前往接种。最后，也要再一次的提醒民众，疫情再次的升温，请大家继续的防疫，评估自身染疫的风险。在人多拥挤的地方，请您戴上口罩。如果出现了症状，马上做检测，以确保您自己还有家人的健康与安全。您可以前往县府的新冠疫情的专门网站，了解包括疫苗还有检测等等更多的新冠相关的讯息。网址是 sccgov.org/COVID-19。祝您有健康愉快的一天。Next, our Sherry Ann will provide the statement in Tagalog.
Magandang umaga po sa inyong lahat. Ako po si Sherry Ann Mangligot, ang inyong Public Information Officer dito sa Santa Clara County. Habang naghihintay ng pag-aproba ng CDC, ang County ng Santa Clara ay magsisimula sa pagbabakuna sa COVID-19 para sa mga batang wala pang 5 taong gulang simula sa Martes, June 21. Sa pag-aproba ng Centers for Disease Control at pagdating ng mga bakuna, ang pag-i-schedule para sa appointment lamang ng mga pagbabakuna ay magsisimula sa susunod na linggo. Ang County ng Santa Clara ay magsisimulang magbigay ng mga pagbabakuna sa COVID-19 para sa mga batang nasa edad na 6 na buwan hanggang 5 taong gulang, umpisa sa Martes, June 21. Ipagpalagay na ang Centers for Disease Control and Prevention ay magbibigay ng pinal na pag-aproba at ang mga supply ng bakuna ay darating ayon sa naka-schedule. Ang CDC Advisory Committee on Immunization Practices ay naka-schedule na magrepaso ng mga pagbabakuna sa COVID-19 para sa mga batang nasa edad na 6 na buwan hanggang 5 taong gulang sa mga pagpupulong nito ngayon at bukas. Kasunod ng pag-aproba ng Food and Drug Administration ng mas maaga ng linggong ito. Ang county ay naka-schedule na tumanggap ng kanyang unang alokasyon ng Special Early Childhood Formulation Vaccines sa Lunes, June 20, at ipapamahagi ito sa mga itinalagang lokasyon. Ang mga pamilya ay makakagawa ng mga appointment para sa mga pagbabakuna sa COVID-19 para sa grupo ng edad na ito sa www.sccfreevax.org. Mayroong humigit kumulang na 100,000 mga bata na mas bata kaysa sa 5 taong gulang na nakatira sa Santa Clara County. Bilang karagdagan sa mga pagbabakuna na darating sa county sa pamamagitan ng Estado ng California at sa Federal na Health Resources and Services Administration, may mga multi-jurisdictional entities sa ating county, tulad ng Kaiser Permanente at ang Palo Alto Medical Foundation, na direktang tatanggap ng mga dosis mula sa mga mapagkukunan ng gobyerno. Dahil sa mga regulasyon na nauugnay sa mga kinakailangan sa edad para sa mga pagbabakuna na ibinibigay ng mga pharmacist, ang mga pagbabakuna para sa mga mas nakababatang mga bata ay maaaring hindi available para sa lahat ng lumalahok na parmasya. Bilang karagdagan sa mga kasalukuyang lokasyon ng klinika na available sa www.sccfreevax.org, ang isang lokasyon ng pagbabakuna sa North County ay magbubukas sa Mountain View sa susunod na linggo. Ang pag-i-schedule para sa bagong lokasyon ay pinaplano magsimula sa Lunes. Maraming salamat po.